Now, the other thing that we talked about was dietary supplementation. So she seemed to have a reasonable diet, but most people with rheumatoid arthritis don't tend to get enough protein in their diet, and that's because they have a higher requirement for protein than the general population. So the guidelines are for people with rheumatoid arthritis, they need to be consuming about 1 to 1.2 grams of protein per kilogram of body weight per day. So that is a lot of protein. So I sent her away. What I typically do with these patients is send them away for 2 weeks to keep a normal diet, but keep a log of how much protein. There are plenty of calculators on the internet, how much protein they're taking during a day, and then make an assessment. Usually what happens when people come back to me with that is they're usually at about 0.6 grams of protein per day, rather than the 1 to 1.2. So they typically then need to supplement with protein. How they do that is then up to them, really. It's not particularly my skill set. I'm certainly not a dietitian, but you can, of course, eat more lean meat like chicken or lean mince. Or you can use protein supplements like protein shakes or bars, etc. And that's a really good idea to do. And what I found is that's pretty much the only thing that has a good effect on fatigue related to rheumatoid arthritis. It really does seem to give good benefit, and actually reasonably quickly as well, whereas most other treatments just do not affect fatigue very well, including the medications.